Hi, I'm Dr. Ralph DiMario, and I'm the medical director at the inpatient facility, or the Delaware Hospice Center, here in Milford, Delaware. We all know it's been a pretty tough year with the pandemic that we've been experiencing over the last year, but we're very proud to say that we've been continuing to see patients here at our inpatient facility or our center here in Milford over the last year uninterrupted. We've made some changes with our visitors and some other things here in the inpatient facility, but most of all, we've been able to continue to care for our patients with serious illnesses. I will just bring to everyone's attention again that the reason that a patient comes to the inpatient facility is very often because they may have some intractable or uncontrolled symptoms that we're unable to take care of at home from our home care patients. Very often patients come to the inpatient facility for a few days, hopefully get their symptoms under better control, and then they go back to the caregivers that were taking care of them previously. Starting in February or March of this year, we're actually very proud to announce that we have some new services that we're going to be able to provide here at the inpatient facility. Namely, we're going to be able to initiate the use of IV antibiotic therapy and IV fluids. Sometimes patients in our home care program will require IV antibiotics, and this will be another help to utilize the inpatient facility or our Delaware Hospice Center to administer to administer IV antibiotic therapy. Sometimes patients come from the hospital having started antibiotic therapy, and now this can be completed here in the inpatient facility. We also provide intravenous fluids, and a complement to that now is the ability to insert PICC lines and midlines here in the inpatient facility as well. So not only can patients utilize IV antibiotics, utilize IV fluids here in the inpatient facility, but if they have the need for long-term administration of fluids, antibiotics, or a CAD pump, we'll be able to do that with the insertion of a PICC line or a midline, again, right here without having to leave our center. One of the other things that I wanted to bring to everyone's attention that we've also instituted in the early part of this year, again 2021, is not marginalizing or setting up barriers for patients who may want to utilize the inpatient facility who are CPR status. So in our home care program, patients, whether they're CPR or no CPR, certainly we admit all of those patients. So we wanted to provide some consistency to our patients and be able to allow them to utilize the inpatient facility whether they were CPR or no CPR status. So we've been very honest with our patients and their families that we are able to initiate CPR and dial 911, but a full code type of scenario certainly wouldn't be able to be accomplished here in the inpatient facility. But it does offer us the opportunity to speak with families and patients and better educate them on the need or not the need for CPR, especially in patients with end-stage diseases. So overall, I just want to remind everyone that we are here all the time, 24 hours a day. There's usually a provider here, even available on weekends to discuss patients, give advice, help admit patients, and to determine which patients meet eligibility criteria here for the inpatient facility. So remember some of the new services that we currently have available to us. Please reach out with any questions that we may be able to help with in terms of your patients at home, and we look forward to hearing from you. Thanks again, and be well and safe.